although lots of people seem to know about Ménière's, lots of people seem to think they have Ménière's, is actually a lot rarer than people think. Ménière's, in its most basic form, is 3 different things that happen to you all at once, it's sort of like a Ménière's attack. The first thing you get in one of these attacks, which lasts over 20 minutes, but less than 1 day. You don't get Ménière's for days and days and days. So it's an attack that happens within 1 day for longer than 20 minutes. And in these attacks, you get very severe hearing loss in one side. So if this was my ear, I'd lose the hearing on this side almost completely during one of these events. And during this time when you've lost the hearing in this ear, you'd get a tinnitus, a roaring sort of slightly low-pitched tinnitus. So I can't do it, but a roaring tinnitus in that ear that you've just lost the hearing in. And the third thing you get is a very terrible vertigo. And this is not dizziness, because dizziness and vertigo are 2 different things. Vertigo is the world is going round and round. If you look into someone's eyes with vertigo, their eyes will be flicking backwards and forwards like this. And it's not just like this. It's a slow and then a fast, a slow and then a fast. As I said before, it lasts for about, less than 1 day, greater than 20 minutes. Sometimes it lasts 2 hours, sometimes it lasts almost a whole day. Then next day, most of these symptoms have almost resolved. A lot of these symptoms have got better. They no longer have the tinnitus. Their hearing has come back again. They don't have the vertigo going round and round. There are some residual symptoms, but they're clearly getting an awful lot better. Everything is resolving. And after a couple of days, everything is back to normal. You're completely normal. You don't have any tinnitus. You don't have any hearing loss. You don't have any vertigo. And you live your normal life until the next attack occurs. An awful lot of people I see in clinic, I did a vertigo clinic for many years, they say, I got told 10 years ago that I've got Ménière's disease. So some patients are being diagnosed with Ménière's because they're quite old, they can't hear very well. They're a little bit unsteady on their feet, and they complain about a bit of a noise in their ear, like a tinnitus noise. But they have that every day, and that's clearly not Ménière's disease. The other way you can point towards it, something being not Ménière's, is because Ménière's generally fizzles out with time. When I say fizzles out, it doesn't get better, it actually gets worse. It's a bit of an odd situation, because rather than going through all the pathophysiology of it, what tends to happen is that there's these events that occur within your ear where certain membranes tear and fluid from one part of the ear goes into another part of the ear and causes damage. And after a few hours, about a day, this membrane that's torn gets healed up again. And then there's a bit of time where the fluid from one cavity gets pushed back and everything reorientates itself so you can hear properly again, the tinnitus goes away and there isn't so much vertigo. Now, these attacks that occur, these repeated tearing of this membrane within the ear, causes hearing loss, permanent hearing loss in that one ear. And so what happens is that tearing this membrane over and over again causes incremental damage to your ear. So the hearing slowly drops. The balance on that side slowly gets damaged. So that perhaps typically we say about 10 years, you have symptoms of Ménière's, where at the start, you're very dizzy, you're vomiting everywhere, you can't hear, you get the roaring tinnitus. But as time goes on, because the ear you can't hear anyway because it's damaged so much, and there's hardly any balance in there anyway, even if you do get this tearing of the membrane, you might hear a bit of tinnitus, a roaring tinnitus from time to time. But because there's so little balance on that side, that it's been damaged so much that you don't get these terrible symptoms anymore. And by roughly about 10 years, you don't really get any symptoms at all, apart from the odd, I think I can hear something, or something strange happens. But because that ear is effectively dead, it doesn't work anymore. So if someone says to me, I've had Ménière's for 20 years, and you look at their hearing test and it looks roughly what it did, what you would expect for their age group, then you think it's unlikely to be Ménière's disease. In fact, that's one of the treatments of Ménière's disease, to actually effectively damage or trying to kill that ear. So some people who have very debilitating vertigo that happens maybe once or twice a week, what we do is we give a drug, we pour a drug into the ear which is toxic to the ear. It's slightly more toxic to the balance system than it is to the hearing system, vestibulotoxic rather than ototoxic. And what that does is that it damages the balance in that ear, but not so much the hearing. So what you're trying to do is, yes, you're going to have hearing loss from time to time. You're going to get the roaring tinnitus from time to time, but you're not going to get the whirl going round and round, because that's a really debilitating symptom from Meniere's disease, the vomiting for a day every 2 weeks or 2 months or whatever. So that's the thing that you're trying to avoid by killing off the balance system in that ear, preserving as much hearing as possible. You'll still, with time, lose your hearing anyway, but for those years, you're not getting the vertigo where everything goes round and round. In this country, for some reason, we really like betahistine or Circ and things like that. It's only really used for Meniere's disease. And even for Meniere's disease, the evidence isn't, I believe, particularly good. I don't think many other countries around the world use betahistine for Meniere's disease because it just doesn't work very well. And say the little old lady I was telling you about who has a bit of balance problems because her knees are bad and she's not quite as good on her feet as she used to, and hearing isn't very good. She's got a little bit of tinnitus. Giving betahistine to people like this is actually probably counterproductive. It's a diuretic. It takes fluid out of your system, and therefore a lot of people get dizzy with betahistine rather than it actually helping them. And because a lot of these conditions which masquerade as Meniere's disease actually get better after a few days, people think, oh, the betahistine's really helping because I'm getting better. And they sort of stuck on this medication for many, many years of their life inappropriately. One of the first things I used to do when I did a vertigo clinic was to try and get people off the betahistine, because it's not, I don't think, particularly useful at all. But I don't want to upset lots of people who believe they've had Meniere's for a long, long time. What I would say is that if you don't fit in to these symptoms and you're saying, I've been told I have Meniere's, I'm on this betahistine, I'm on all these treatments, I've been told I got Meniere's disease, and he's saying something different. If your life is fine, there's no need to go and see your doctor if everything's okay. If, however, you feel like, actually, maybe this guy on YouTube might be saying something that maybe things have changed recently, or maybe our knowledge about vertigo has changed slightly, it might be worth seeing an ENT surgeon or your family doctor just to reassess whether or not you actually have Meniere's disease or not. Because an awful lot of these conditions that masquerade as Meniere's disease can be treated. And there are loads of diseases out there. One of the most common ones is migraine. A lot of people don't understand migraine very well. They think it's just a bad headache or a very severe headache. It's certainly not. It's abnormal blood flow through your brain that can cause a lot of the symptoms similar to Meniere's disease, but it seems to last a lot longer. But I'm not going to go into vertigo because it's a huge topic and it was meant to be a short video. I hope someone out there found that useful. Do take care. Bye-bye.